Welcome to May I Hold Your Hand. I'm Nurse Tash, and I'll be taking great care of you today. If you followed me and listened for a while to Pregnancy Weekly, you'll notice that there's been a shift in language from the fetus or the mother and saying things of that nature. That shift in language comes as an intentional shift so that I provide personalized experience here at May I Hold Your Hand. It just felt more intuitive to me, as if I were speaking directly to you in a room. I certainly would not be saying the fetus or these sorts of things. And so for the remainder of this series and any other recording you hear my voice, I will speak in ways that make you feel as if I'm right there with you. So, thank you for coming back. This is my Pregnancy by Week series where I teach what is happening in your body with each week of pregnancy. Last week we discussed week 13. If you missed it, now's the time to go ahead and pause and come back after you've listened to what's going on. It's week 14. Your baby is now the size of an apple and covered in fine hair called lanugo. They may start to develop a preference for sweet taste, and its movements may be visible when looking at your belly. As usual, your baby is growing fast and developing more each day. Their heads are still large in proportion to their bodies, but their little body is beginning to catch up in size. Your baby is also developing more detailed facial features such as eyebrows, eyelashes, and tiny buds that will become teeth. Your baby is swallowing amniotic fluid and producing urine. Their liver is producing bile, which helps break down fats in the digestive system. How are you? Well, you may be starting to feel better, as some of the early pregnancy symptoms such as nausea and fatigue may start to subside. Your uterus is expanding and may feel a slight bulge in your lower abdomen if you placed your hand there. Your blood volume is increasing and your heart is working harder to pump blood to your baby. You may also be experiencing some skin changes such as darkening of the areolas or a dark line called the linea nigra down the center of your belly. Your hormones continue to fluctuate, which can cause mood swings and other emotional changes. So it's essential to continue taking care of yourself during this time by eating a balanced and nutritious diet, staying hydrated, and getting regular exercise. You should also attend prenatal appointments to monitor the progress of your pregnancy and receive any necessary medical care. Thank you for joining me for this week's Pregnancy by Week series. Next week, it'll be week 15, so be sure to come back and learn what's happening. As a reminder, this is not a substitute for medical advice or professional health care. So if you suspect that you might be pregnant, contact a licensed obstetric care provider so that you're able to get the care and attention you deserve. Bye-bye now.